welcome, Kira. Good to
Thank
see you, as always. So, Kira, background in what we do to become scientists and what we're doing is always very interesting to me. I know that you come from a little bit of a different pathway to get to where you are and doing the research that you're doing. It's a very an interesting story, but you are really, really valuable to the department, and so many people want to work with you because of your skills and what you do. But tell me, just in terms of what led you to want to be in this type of field where you're working in science and research and trying to make a difference for patients. At some point, was there an inspiration that led you to say, I'd like to do this and not make this my career?
There were so many inspirations, but for me, it was always art or science, or art and science was what I really wanted. And, through school, I was told you have to pick one. And so I would go all the way to science and then get to a point where I just couldn't stand it. And I would go all the way to art. And so this back and forth was awkward. And I finally graduated undergraduate work in art. And when I went back for my graduate degree, it was in biomedical visualization. So that was the first opportunity I had to combine art and science. And as I was finishing that program, really what I realized I wanted to do was quantitative imaging. I wanted the imaging to be the science, not just be about the science. And that there were a lot of new imaging modalities starting up at that point. This was in 1997. And there's been a lot of progress since then.
What a great mixture and what a great way to kind of bring your interests together, because all of us feel when we see the images of the eye and when we see the way that the eye can be imaged to try to understand the structures and understand how it works better. One thing we always stop and take a look at and say, wow, this is really beautiful. But it does take an artist, I guess, to really think through all of the ways that you can visualize and see those structures to be able to really maximize the ability of what that image can do to help a clinician or help a research scientist. And I imagine that your skills in both have been helpful. Am I stretching that truth too much, or?
No, it was a very good program for me, and it brought me back into science. But it really does. It's an interesting field. It exploits both sides, and there are areas of emphasis within the field. So medical illustration is part of it. Prosthetic design is part of it. Graphic user interface, with medical and teaching tools is part of it. There's a lot that's going on with that field, and we use it all the time. It's just, even though it's right in front of us, we don't actually recognize that that's where it comes from.
So tell us some of the things that you're doing with in your own lab and with some of the other faculty, because some of it I know a little bit about as it relates to how it's directly helped patients, but you're using technologies like OCT and other types of imaging technologies, and you're applying them in lots of different ways. So if you could share some of those details with us.
So I run the imaging module for ophthalmology research, and it's part of our core grant. And we've had that grant for a long time, and it's specifically to support ophthalmology researchers, be they lab researchers or clinical researchers, and to give them access to equipment and support that they might not be able to afford at a single laboratory level. But it also lets us bank a whole level of intellectual capital with the people that are funded by the core. And that's my primary job. That's what I came here to do originally. And then as that was developing, and we're working with lots of all of our researchers on confocal microscopy and wide field fluorescence microscopy and live cell imaging and just all sorts of different things. Dr. Schumann at that point then asked me if I would be interested in incorporating an OCT system into the imaging module, and of course. And so I was just starting to learn the OCT when we had a lecture by a visiting professor, Virendra Sangwan, and he, in that lecture, said, would somebody please come up with a way to see the structure, which was the Palisades of Vogt. And I was like, why couldn't we do that with OCT? And so that's what started this whole process of me beginning to do my own research and then working with clinical patients. And that's a real privilege to be able to go between the lab science part and the clinical science part, and to have just kind of the broad range of support I've had from different colleagues and our chairman and, clinical partners. I mean, it's a real privilege to be able to work that way.
So you mentioned the Palisades of Vogue. That sounds so cool. But tell us a little bit about what those are and their importance in the structure. It's a very important thing that you're able to do that. But tell us why that's important.
We don't know that much about the Palisades of Vogt. They're recognized as the corneal epithelial stem cell niche. So it's the area where the stem cells that create new epithelium for the surface of your eye live. And we need those cells because every time you blink your eye, you're clearing away some old cells from the surface. And so there needs to be a constant replenishment of new cells coming in and keeping the surface of your eye healthy so that it doesn't dry out, so that it's protected, and just so you're safe and able to have a clear cornea in the front of your eye. So what we're trying to do with imaging the Palisades is determine what happens with that structure and when, because it's been reported that the structure changes over time, particularly in certain disease conditions. And we think that by being able to image it, we'll be able to track and monitor people who might be in danger of losing those stem cells. And that would really help the treatment planning and our ability to assess whether or not they need an intervention. And there's a lot of different things that can be done. I mean, that you can do things like corneal transplants, but the corneal transplant won't survive if they don't have stem cells to make a new epithelium. So if we can assess that area and make sure they have those stem cells, they have something to help support the transplant, then it'll help make sure that transplant tissue is used appropriately, and also that patients aren't undergoing surgeries that aren't going to be helpful for them, and that we can choose to transplant patients based on the science and the imaging and have the added information for it.
That's fascinating. Now, I do know, because I know that it was something that we helped you with the support, is that you also can use that technology, in a clinical setting, like as a surgery is going on, to help find those Palisades and identify where they are, so that the surgeon can try to preserve those when they're doing the transplant. And I think we helped you get a stand for that. And so it's neat for people to understand that that's how they can make a difference. Is, if we have someone like you who's got a really great idea and a way to implement it, something simple like that, it was really just a stand that kind of help you identify, to help you hold the OCT in place, right? So you can help Dr. Nichelle do that procedure. And did I phrase that right?
Yeah, that stand is actually still in use in surgery over at Children's. And it was built with the help of some of the bioengineering students. So we actually used it as a product development project for some of the students. And the stand requires motion in a lot of different areas. So it's actually a harder thing to build than it sounded like. But it served many purposes. I mean, it actively helps us assess patients. In the clinic now, it served as a teaching tool within the bioengineering department. And it served as a way for me to also do some research in the lab here back at Presby.
Well, you know, it comes back full circle to where we started the conversation related to science and art. I've heard this said before, is that you know, really great scientists actually do have you know, an interest in art or an appreciation for art, because in art you have the ability to take a look at things and sort of turn them around and spin them around and look at them as a, you know, as an object that has, you know, different types of purposes and uses and structures. And that's a different way of thinking and a different way for the brain to work than maybe someone who has more analytical interest in science. So again, I think that's a full circle how your combined interest made an impact. But it ultimately, it's exciting that your work immediately helps some patients, and I expect that we'll see more of that in the future.
Certainly.
So tell us a little bit about some of the plans then, as we segue to the future. What are the things that we can accomplish in these areas that you're interested in? And certainly I know that you you know, want to continue to expand and grow in what you do. So tell us some of the things that we may be able to accomplish in the future with the right help.
So at this point, we're still developing the analysis portion of the Palisades. We know we can image them, but coming up with a good way to show them and assess them, and a non-subjective way to assess them, has been a very complicated problem. And actually, I have a colleague at CMU who is a specialist in image analysis, and we are working together. And at this point, it's just a matter of building the software and getting through the testing phase to be able to actually produce consistent images that allow us to assess Palisades. So at that point, you know, then a whole new phase of the research starts, because when you can reproduce what you're doing, then you're able to really do science. It's not science until you can reproduce it. And so now what we want to do is we need to understand the developmental trajectory of Palisades. We don't know if they're present at birth or if they develop in a couple of months after birth. And that has a direct bearing on how would we use this technology to treat young patients, especially patients with things like congenital corneal opacities. So we need to understand that side of things. But then on the other side, when somebody doesn't have Palisades, one of the things that can be done is a limbal transplant. And so you can do that from one eye to the next eye in the same person. You can also do it with living relatives, or you can do it with cadaver tissue. And so it all just depends on what's available. But when they do cadaver transplants, they don't tend to be particularly successful. But one of the things that hasn't been taken into account, because we haven't had the technology to do it, is what happens to Palisades after you die. So when we preserve corneal tissue, you know, that's for a corneal transplant. And actually they're recovering the limbus with that tissue. And so that's where they can also harvest for a limbal transplant. But all of the protocols and all of the you know, timing and assessment of the tissue is all geared toward cornea. So my suspicion, and again, I need to be able to assess this in a quantitative way to be sure, but it appears that Palisades actually change very quickly after death. So if you were going to do a successful limbal transplant, the timeline for recovering that tissue and actually performing the surgery would be different than what you might have for corneal tissue. And so that could
Interesting.
be really important for people who are having corneal transplants and need a limbal transplant as well.
That is very, very, very interesting. So hopefully in the future, with that knowledge, essentially we may have either a better corneal transplant or a way to transplant just the limbus to maybe people who otherwise uh, aren't producing the stem cells that they need to maybe make their cornea healthy.
Yeah.
So we'd have a way to be able. Okay, very, very neat. Wow, it is always fun to learn these things from you. You've been in the department for 16 years, and these last few years, and I've been almost working on 11 years, which is crazy to me. But in these last few years, we've had a lot of changes, and certainly a lot of growth and new faculty and other things. Is that changing things for you? Are you working with more people as well? And is it any of that exciting for you? Some of
Oh, it's
those.
very exciting. There are a lot of people who are coming in, and we're not as close as we were, because as the department has grown, we have to be kind of, some of us are in one building, some of us
Yeah.
are in another building. We're a little bit scattered. But because of the core and because of the module, I end up working with many of our different researchers at some time or another. And sometimes it's just they need a few pictures, but I also do all the training on all the instruments. So that gives me a chance to actually spend some time with researchers and their people in the labs, the postdocs, and even the students who come through the labs. So, working with that range of people is always exciting, and learning about their research is always exciting. But they also, because of the different kinds of research that we do, they have different problems with imaging things. Do they need to image retina? Is it, slides on a microscope? Is it OCT? Is it, what are the problems with each one of those kinds of imaging? And that's exciting for me. And that's very rewarding to be able to participate with different people. And I think as we move over into the new building, that's going to be a very exciting time for us, because there is something about having kind of hallway interactions with people. If I'm working with one investigator and they've been doing one thing or using a fluorochrome or an antibody that is particularly successful, and we're walking past somebody else who's been asking about it, I can say, hey, you too, and those kinds of conversations where somebody just stops in the hall and says, oh yeah, I can show you how to do that. Or I've noticed this and we've seen that, and this might help you. That becomes a very rich environment, and it'll be exciting.
That is, I can imagine for you that really is going to open up some doors, and I agree that it is so much better when we have a chance to have those interactions that are more natural, and we're all looking forward to that when that day comes, which is really around the corner once we get through all of the period that we're in right now. Well, thank you. This has been, as always, interesting, but also really helpful, because I think that I can see that there are many ways that what you're doing will really impact patients' lives for the better, which is ultimately the goal for all of us. And so, thank you for applying your many skills and tools and your art and your science, and doing it in such a positive and productive way. So, and thank you for coming and sharing it with me today.
Thanks, Lonnie.